webinar, the first webinar of 2015, Succeed in Germany's Healthcare Market, focused on the German hospital market. I'm your moderator for today, Omar Oweiss, Director of Investor Consulting at Germany Trade Invest in the Washington, D.C. office. And you probably came across this website. This is probably how you were able to register for this webinar. The Succeed in German Healthcare website, our dedicated webinar website, where you have all the information about this webinar, upcoming webinars, and past webinars. Live streams are there of these webinars. And just a quick, some quick information about this series that you're joining us today, if it's the first time. It was launched over a year ago in December 2013. In 2014, we had 4 successful webinars. We looked at reimbursements, we looked at bioregions in Germany, we highlighted the aging society, the digital healthcare, and here we are, 2015, first one of the year, the German hospital market, and it looks like the next one will be on OTC and self-medication. I say this because I just want you guys to know that we try to keep it interesting. We try to highlight all the different aspects and business opportunities and changing trends in Germany. And also this webinar was actually a suggestion from Tom Sommer, the president of MassMedic, the Massachusetts Medical Device Industry Council. So we are happy to keep them interesting and keep them relevant for our attendees and for our listeners. Today's agenda, again, the German hospital market. I have 2 distinguished speakers. My colleague, Ms. Julia Rühle from the headquarters, Germany Trade Invest in Berlin. She will give us a presentation on the German healthcare market, as the title, but also highlight the importance of the hospital sector within this industry in Germany. She'll be followed by Mr. Marc Schreiner, German Hospital Federation, at the German Hospital Federation. We're very pleased that we were able to get such a high official at the German Hospital Federation, because Marc can really give us a great in-depth overview of this market, this sector, the structure, some of the challenges facing it today. Really encourage you all to post questions through your webinar toolbar. You will not interrupt the moderator or any of the presenters. You can do this at any time. I will be able to collect these questions, and we will have a Q&A, interactive Q&A session at the end. So feel free to post any questions you see fit. Just real quick, if this is the first time you're joining us, Germany Trade Invest, who we are, what we do. We are officially the Foreign Trade and Inward Investment Promotion Agency of Germany. Do a lot of different things. So in a nutshell, to try to summarize this for you, we help international companies establish business operations in Germany. We're a resource, really. We have publications and services, and all this information is free of charge to our clients, and the inquiries also can be kept confidential, because our goal is to highlight Germany and to attract foreign investment into Germany. We also have this unique set of services of individualized consulting for our clients. It includes, but it's not limited to, market and industry reports, market entry analysis, tax and legal information, funding and financing opportunities in Germany, partnering, site selection, highlighting the different clusters in Germany or different cities or different metropolitan areas, et cetera, et cetera. We are your resource to Germany, and we are very, very happy and very eager to help you with considering Germany as an expansion location. Enough from me. I know that you guys have not tuned in to just hear me speak. Let's get on with the show, as we say. So our first speaker, Ms. Julia Rühle. She's a manager of investor consulting as well on the chemicals and healthcare team, and she will give us the presentation of the German healthcare market. And I will hand over the rights to her at this point, and I really look forward to her presentation.
Thank you, Omar. Hello, everybody. Good morning and good afternoon, depending on where you listen to us from. This is my presentation. Let me just switch over to full screen now. And I will now give you an introduction to the German healthcare market and show you some interesting facts and figures to let you understand the size and the importance of one of Germany's largest growth markets. We are about, well, a little more than 80 million inhabitants in Germany, and the vast majority has health insurance. 86% have public health insurance, and these more than 86% include people with mandatory health insurance. That means that they are employees with an annual income below a certain threshold. This group also includes family members and people who are already retired. And another group is people with voluntary insurance. That means that they are either self-employed or they are employees with an annual income above that certain threshold. So they can choose to either stay in the public health insurance or they can opt out and have private health insurance. That's why it's called voluntary insurance. And about 11% have private health insurance, so people who meet that income requirement and are under the age of 55 can opt out of the public health insurance funds and have private health insurance. Then we still have a small portion left, 2.5%. These 2 million have either a different insurance claim, for example, if they're welfare recipients. This also includes people who do just not make any, who don't give information about their health insurance status. And although health insurance is mandatory in Germany, there are still a few thousand who have not insurance at all, for example, if they're not registered. So all in all, we have 7 million people with public health insurance and about 9 million people with private health insurance. And both groups can freely choose between providers. We have 124 public and 45 private health insurance companies in Germany. As I said, the healthcare industry is an important growth sector in Germany. In 2012, we exceeded the 300 billion euro mark of health expenditure in Germany. If you look at this time span of 20 years, we see a growth rate of 3%. And this is due to multiple factors. First of all, we are an aging society in Germany. That means, our population is getting older and older. We are already the oldest society in Europe, and the second oldest population in the world after Japan. With this also other developments come along, for example, more people with chronic diseases, people who are care dependent. We also see this number growing. But people also become more aware of health in general. They spend more money privately on health care. And of course, the increase of health expenditure comes from the technical advancement that we also see. If you look at where most of the money comes from, here public health insurance is the main source of funding in healthcare expenditure, 57%, followed by private households. And if you want to know where most of the 300 billion euro go to, it's hospitals. They have a share of more than 26%. And so, it's basically the largest share of healthcare expenditure in Germany. So the 300 or more than 300 billion euro health expenditure account for 11.3% of GDP in Germany. And we also see this number growing, as I said before, and we see a continuous demand for healthcare services in Germany. The healthcare industry is also an important employer in Germany. We have more than 5 million people who are employed in the German healthcare industry. And here again, we see a steady growth in these numbers. We expect that in 2030, so in about 15 years, we have 7 million people employed in the healthcare industry. Here again, hospitals lead. They are the largest employer within the German healthcare industry with more than 1 million employees, followed by medical practices and long-term care facilities or nursing homes. So we have more than 5 million employed in this industry. We also have 2.3 million healthcare specialists, for example, therapists for speech, midwives, but also mechanics that are employed in the medtech industry. We have more than 200,000 general practitioners, dentists, and other specialists. And we also have an extensive network of pharmacies in Germany. We have more than 21,000. So there's basically a pharmacy around every corner, at least in metropolitan areas in Germany. And of course, what you've all been waiting for, the data for hospitals. We have nearly 2,000 in Germany. And with that, I will end my part of the presentation and hand over to Marc Schreiner, our expert on hospitals. I'll leave you with my contact information, and with that, I will hand over to Omar again.
Thank you so much, Julia. Let me take those slides right back. Should have worked. Great. Wonderful. Thank you, Julia, for an interactive presentation. It's always nice to have a presentation like that, especially when there's a lot of numbers being thrown at you. So thank you so much. Marc, our next speaker. Again, very, very happy and very distinguished speaker. Happy that we were able to have you for this webinar. He's the Director of EU Policies, International Affairs, and Health Economics. He seems to be doing everything at the Deutsche Krankenhausgesellschaft, or the German Hospital Federation. And in addition, we've been able to acquire him for this webinar. So, Marc, I hand the rights over to you, and we look forward to your presentation.
Thank you. Good afternoon, we say here in Berlin, to everybody who is now on the phone. I am very pleased that you take your time to be with us today and to have an insight into the German hospital market. My name is Marc Schreiner, and here in the Hospital Federation I am responsible especially for our EU affairs and also for international relations and health economics.
Marc, sorry to interrupt you. We don't see your screen yet. I'm sorry to interrupt you.
So,
yeah,
what shall I do?
Show your screen. There should be a little button that says show your screen.
Just a second. I have to check for it. Where is this?
It could be behind your presentation. Let's try again. I'm going to take the rights right back. Bear with me now.
Yeah.
All right. And we're going to try one more time. You should get a little pop-up window.
Okay, so now there's a pop-up.
There you go.
And now you should see the screen.
Excellent.
Does it work now?
It's all yours. Thank you, Marc.
Okay, thank you for helping. So, in our federation, as I said, I am responsible for EU politics, international affairs, and health economics. Today, I have the pleasure to give you an overview about what is the German hospital market. I would like to start my presentation with a short description of what is the German Hospital Federation. We are the representative organ of all German hospitals, so regardless of the kind of ownership, we do not have any mandatory membership, as this is the case for example, for doctors. But as our organization has been provided with a lot of legal tasks, there is in fact a kind of mandatory membership, because if you do not have a voice with us in the politics, in the so-called self-government in the German healthcare system, then you don't have any voice. So in fact, there's a kind of mandatory membership. We have 28 member organizations, 16 hospital federations on the federal states level. They have special tasks. For example, as the hospitals are admitted by our federal state governments, it is the task of our regional hospital federations to negotiate the so-called hospital plan with the regional governments. Each one can apply to be admitted on this hospital plan, and once this is the case, you can even have a claim for subsidies for the investment in the infrastructure. But it is the political decision of the regional governments on whom to admit on this hospital plan. It is their decision how many beds in which region with which specialty they want to have. But in general, this admittance is open to everybody who's applying. The regional hospital federations does also have the task to negotiate prices. In Germany, we still have price system on the regional level. I will explain this a bit later because I guess this is crucial for you. Our organization consists also of 12 federal associations dedicated to the type of ownership of the hospital. So we have Federal Association of Private for-Profit Hospitals. We do have Federal Association of University Hospitals. By the way, there are 33 university hospitals in Germany. And also Federal Associations of churches and other charity-based organizations like the Catholic, the Evangelic, and even the Jewish hospitals. We have like the Red Cross and so on. So this is our composition of members, and we do represent all those hospitals on the national level. We are the partner of the politics. The law is made in Germany, in the German Bundestag, and so this is our most important partner to discuss with. But once the legal framework for the provision of hospital care is set up by the Bundestag, sometimes also in conjunction with our Bundesrat, which is the chamber of the federal states, once that this legal framework is set, in Germany we have the principle of self-government. And this is very important for you to know if you want to become active on the healthcare market in Germany, especially in the so-called Federal Joint Committee in Germany. The representative organizations of the service providers, so the salaried doctors and the hospitals, the dentists, are sitting together with the representatives of the health insurance funds, and we in this composition take binding decisions on what is the scope of the healthcare basket, which has to be paid for by the statutory health insurance funds. We also do decide about the access of new innovation, pharmaceutical as well as medicinal product, if there is added value or special benefit, so that these new innovation can have entry into the market of social care, so social health care. We also take binding decisions on the quality which has to be provided by the service providers. So, for example, we are taking binding decisions about minimum volumes which have to be delivered by hospitals. If these requirements are not met, then there is the chance that the respective service provider can be excluded from the right to deliver this service to statutory health insured patients. So that's a very crucial committee, which is, as I said, called the Federal Joint Committee. And we, as the German Hospital Federation, are one of those organizations which together consist the Federal Joint Committee. Another legal task we have been provided as the German Hospital Federation is also the development of the German DRG system, so that's a diagnosis-related groups system. For those who don't have such a system in their country, hospitals get a fee which includes all this, the efforts which is necessary to heal a patient. So from the admittance of the patient till the discharge, everything is covered with this fee. We purchased the license from Australia already in the late 1990s and developed an own German DRG system. Today there are 1,200 different diagnosis groups with up to 7 different levels of complication, and this allows us to describe very detailed what treatment was done in a hospital. And this we have for this we have ICD-10 codes, we have operational codes, which allows us to group the treatment into one of the nowadays more than 1,200 diagnosis groups, and at the end there is provided a so-called relative weight, and this relative weight is then calculated with a price, and now I'm coming back to the regional hospital federations, which has been negotiated on the regional level. So our regional hospital federations negotiate on the regional level of each federal state the price, which is then multiplied with a relative weight. And so the same treatment today still costs, in the 16 states we have 16 different prices, but we are on the way to develop an own federal price, which then will be binding for all. This DRG system is not is only valuable for somatic care, but we are on the way to develop such kind of DRG system also for psychiatric care. So now you have an overview about the tasks of the German Hospital Federation. I now would like to continue by giving you some figures on the German hospitals. Here you can see the different owners, the share of the hospitals they have. Here you can see on the left side our 16 federal states. You can see that the composition of what is public, charity-based and private for-profit hospitals is differing due to the political decision of the regional government. And you can see that, for example, in Saarland, which is in the southwest of Germany, there are no private for-profit hospitals at all, while in Bremen, for example, you have 50% charity-based hospitals. In Saxon, it's only 22%. So there you can see that there are big regional disparities. But in general, you can see here on the right side in this cake that the share of public, charity-based and private for-profit hospitals is more or less 1/3 each. You can see how this developed in the last time. Here it is another visualization of the share of ownership. You can also see that the private for-profit hospitals are gaining market. You can imagine that public hospitals in times of financial crisis also, but in times of scrutiny, which is always the lead for our budget decisions in the hospital budgets, that hospitals from the public hand are closed down, but that there are private for-profit hospital owners who purchase them in order to continuously run them. So what remains stable is the market of the charity business. You can also see some other figures concerning the hospital beds. You can see this is the number of hospitals in Germany. This is here you can see the number of beds. And Omar, I'm a bit I cannot see everything of my slides, so now it's going. Okay, so here you can see the number of hospitals which decreased severely since we introduced the DRG system in early 2000. This is the same for the beds, while the occupancy rate remains more or less stable. So now there is Hello?
Yeah. Just give it. It may just be.
Okay. So the
lag.
next, I wasn't able to click on the next slide. So now it should be working. So here on this slide, you can see that the number of cases is rising year by year. This is only for the inpatient cases. What you see here. Today we were treating in 2013 18.8 million patients in inpatient setting and another 20 million patients in ambulatory setting. Usually those two sectors, primary care and hospital care, are severely distinguished in Germany, but in the last 10 years we achieve more and more that ambulatory services can also be delivered by hospitals. This is for highly specialized care, this is for emergency care, and it is a continuous discussion with the representatives from the salary doctors, so the primary care sector, on who can have a share of this kind of market. You can see that also the length of stay is continuously diminishing. This is also due to the invention of the German DRG system, leading to the fact that the hospitals try to become more effective. So here you have an overview about the core data of what affects a hospital market. Again, you see that the number of cases is rising very much. This is also due to the demographic development of our society. As Ms. Rühle said, we are an old society, and this is also to be seen on the market for hospital care. The needs of services is rising. And you also have to know that the case mix index, so showing the complexity and of the services delivered, is also very much rising. This is a great challenge for us because we have now need for more doctors, for more resources, and this is a threat or a challenge for a whole society. As in your countries, this should be the same. So here you can see some figures on the what has been spent in the German healthcare market, especially from the statutory health insurance funds. You can see that the share of the hospital spending is the biggest one. Actually, from the statutory health insurance funds, we get 65 billion euro, and you can see here that this is with 35%. The biggest block of the expenses of the statutory health insurance funds. Additionally, you get from the private health insurance funds the reimbursement for private insured patients, and there you can see that we have nowadays 6.9 billion euro as earning from the private patients. Additionally, there is a lot of resources to earn money for hospitals. For example, you can sell extra services like, for example, treatment by the chief physician personally. You can buy the service to get one bed room. Usually these are 2 beds or 3 bedrooms. So there is around the core, around the treatment of the patient, some other possibilities to earn money. In Germany, we have 2 big resources of financing of the hospital care. The statutory and the private health insurance funds, they pay for the treatment, so these are the running costs, but the infrastructure, the investment costs, they are borne by the federal states, as they are by our constitution in charge to assure the hospital services in their states. And this is also the reason for which they have the right to define the hospital plan, but this is also the reason for them to have to pay money for the infrastructure. And you can see that in the last, in 2013, the spending of the federal states was only at about 2.7 billion euro. We, as the German Hospital Federation, we calculated a need of almost 6 billion euro. So you can see that the gap was big. You can see here on the right upper side a slide which explains a bit how the states were spending in the former Western Germany. This is the dark green line, and since we got reunified in early 90s, you can see what was spent now in the eastern part, in the so-called New Germany. And you can also derive from this slide that the infrastructure in the eastern part of Germany is quite modern. It is not so dense as in the western part, but it is very modern, whilst in the western part there still is a big need for investment. You can see here by country what was invested. For example, North Rhine-Westphalia, they spent almost €500 million, but they also do have a big number of hospitals, almost 500. Coming to hospital staff, we have 1.2 million employees altogether in the German hospitals. In full-time equivalents, this is almost 850,000, and you can see that we have in full-time equivalents again 150,000 doctors and 315,000 nurses. But you can see also here on the right side of the slide that the number of doctors was increased enormously since 2003. This is due to European Union law. For those who come not from the EU countries, I have to explain that in Europe we can get binding law, binding requirements from the EU level, which then directly has to be applied in the member states of the EU. And here you see the effect of a so-called EU Working Time Directive, which forced us to employ almost 40,000 doctors more. This is causing 1.7 billion euro additional labor costs per year. But as much as the money is hurting, what is even more hurting is that the market for doctors is empty. We have 1.5% of unemployment rate only in the doctor sector, which is almost full employment. So we have to go to recruit to foreign countries, and I looked into our statistics, and from those, next slide, from those, these are now the real persons, 180,000 doctors working in the German hospitals. We have 14,300 coming from the EU, from the other countries in Europe together. There are another 4,500 people, so almost 18,500 people coming from European continent, and altogether worldwide there are 25,000 doctors working in our hospitals. For nurses, we do actually don't have we do not have those very detailed figures. But just that you can get an overview. You have to be in mind that the labor costs remains with almost 2/3 of our costs in the German hospitals, the biggest block we have. Here I have prepared an overview for you where you can see the key facts again as at a glance, and then we have another slide for you where I just want to have a short walk around to explain you the basic principles. You have to know that all hospitals in Germany, regardless of the kind of ownership, have to comply with the same legal rules. So there are no specific rules for public hospitals or for charity-based hospitals. All have to comply with the same rules. The reimbursement system, which we developed on the national system, is also the same for every hospital. Also the same working conditions which have to be offered for the staff. Despite this general requirement to apply to the legal working conditions, we have a wide and very differentiating landscape of tariffs. Trade unions and also employers' organizations can negotiate on tariffs, which is done in a very big number of cases, and in these tariffs, differences in prices, in working hours are allowed, but beside this, the working conditions, the working law is the same for all hospitals. A very crucial point is also that we have to comply with the same quality standards. As I explained to you in the Federal Joint Committee, we set binding standards for quality requirements. This is concerning structural requirements, so which kind of building, which kind of infrastructure inside the building has to be provided. This is concerning process quality indicators, so which ways of treatment have to be compiled with, and also the results, the quality of the results is agreed on in the Federal Joint Committee. And every hospital has to comply with those standards. And to have transparency if they do so, we have developed a so-called external quality assurance system. Every hospital has to continuously submit data to an external institute, the data concerning the indicators, whether they are complied or not. And this external institute is assessing and evaluating this data. If the data is too bad, so if the hospital does not deliver good quality, then visitors of this external quality institute come to the hospital, talk to the management, even or to the management of the department, and check the reason for which the quality is so bad. Then there is a kind of agreement from this institute with the hospital, and this agreement bears a period of time and the result, with the aim that the hospital has opportunity to bridge the quality gap. And about this whole process, the hospital gets a report on more than 400 indicators on which we continuously have to submit data. And this report is then published annually by the hospital itself, the so-called quality report. And this is accessible to all patients, to all sending doctors, so that there is a high level of transparency what concerns the quality. And this is also provided in English. We created a website as the German Hospital Federation. We are running an official hospital directory where every patient throughout the world can have access to, can search for the hospital which is matching his requirements, and then also has access to this quality report, so that he can have a sound knowledge base on which he takes a decision to might come to a German hospital. So this is only one point of on the topic quality. And with regard to the time, I do not repeat myself again on the admission for the hospitals. Again, this was done by the regional governments, but, and this is a core principle for the German hospital market, the patient has the free choice in which hospital he can go. He is not binded by his doctor or by anybody else in his choice where to go to. So there is free choice, and by EU law again, this free choice is now widened to the whole EU country. So a German patient can choose throughout the 28 member states in the EU in which hospital he or she would like to go, but also for us a good market opportunity to receive patients from abroad. And with this fixed price system, as I told you, the binding quality indicators, you can see, also combined with a big level of transparency, that the competition for patients is led only by quality and by transparency of the German hospitals. This is asking us to continuously develop our quality, to continuously become more effective, and this is a reason for which the German hospital service in all queries since the last years is estimated as an internationally renowned good hospital care system. So with these general closing words, I also close my presentation, and now I'm available for discussion.
Thank you so much, Marc. That was truly in-depth. We really appreciate that. I'm actually going to leave your screen just on for another second in case somebody else wants to, in case some of the attendees want to write down your contact information. All the presentations, we've already collected quite a few questions here, and all the presentations will be available, and the entire webinar is being recorded, so you can view it at a later time. All right. You guys enjoyed both presentations. It is time for our Q&A, so we'll go right into it. We have about 16 minutes left, so bear with us, and I hope hope both speakers are not on mute. Here we go. First question, how will the German government plan to address the problem of increasing healthcare costs, and which aspects and what are their priorities?
So we, at the moment, are facing a new law, a big hospital reform. In this hospital reform, there are a lot of points, especially concerning quality. We just invented the inauguration of a new quality institute, which now has to deliver a lot of data. As I explained to you, for example, the high level of transparency on quality now has to, there will be a follow-up by this official institute, and we will have evidence on the question whether the level of transparency raised the level of quality. But beside this major core of the new reform, we had in the last years a big discussion about the continuous development of cases. Often there was the view of the statutory health insurance funds that hospitals would produce more cases than really needed in order to get more cases, in order to get a higher revenue. But we have this development. We are not catching the patients from the street. They come to our hospitals and ask for services. In reverse, we say this is a proof of quality, that the access to highly specialized care is so good that the patients can come, and this is also continuous development discussion with the politics concerning the development of prices. We have in Germany the mechanism that the prices are not allowed to raise without any cut. So we have developed from the Federal Statistics Office a yearly rate which describes the raise of the labor costs, the prices, and when negotiating the prices on the Länder level, these statistics on the price raise, in overall price raise in Germany, is has to be taken into consideration as a kind of maximum. So this is one of the means to limit the raise of costs. Then we have some systems that if the hospital, the agreed numbers of cases in a region is exceeded by the hospitals, then every case which is beyond the agreed on limit of cases will not get the full fee, but the hospital has to accept a reduction of the fee. So also this was invented in order to limit an unrestricted development or rise of cases.
Thank you, Marc. A question for Julia. It came during your presentation. What is the percentage of the German population that is over 55?
Oh, that is a good question. I don't have this number right now, but I can give it to you later on if that's okay. Or
I heard
maybe,
that in, oh sorry, I
No,
heard
no,
that in
go ahead.
2050 this percentage will be about 30%, but in 2050 only.
yeah.
I know
We'll
that
find
even
out and send it.
both of you did refer obviously to the aging population, so I know that's
Right.
probably truly why that question was raised. What is there a current shortage of physicians, and if so, what are the specialty areas?
Sorry, Omar?
Is there a current shortage of physicians in Germany, and in what specialty areas?
Yeah, we have a big shortage of physicians. Also due, again, to the EU Working Time Directive, we had to employ so many doctors. And today we have figures that almost 5,000 positions cannot be filled again in due time or at all by the hospitals. This is only affecting the hospital sector. The problem becomes even bigger as also the primary care sector faces a problem that a quarter of the doctors working there is also going into retirement in the next 10 years. So we have a big need for doctors. Concerning the specialization, this is difficult to say exactly which, but we had during the last years, for example, a severe shortage of anesthesiologists. But this is only one detail in the whole problem. What we are doing is to recruit abroad, despite we in Germany comply with the WHO code on ethical recruitment of health personnel. So we try to avoid recruiting in countries where recruiting would endanger the healthcare in the respective country. But nonetheless, we have our needs as well. So what we're talking about is to raise our own training capacities, to change the access to the universities, to lower a bit the requirements to the young people, and then also to raise the training capacities in the hospitals in order to get more doctors. But this is a process which we discuss already about since more than 5 years. Until now, not so much happened, but I guess as this is a mid or even long-term problem, the pressure, the political pressure is not yet high enough to cause really concrete actions, but this will come surely in the near future.
Thank you, Marc. Thank you, Julia. Question here. The number of hospitals in Germany are going down. Are they merging or being shut down?
The both. There are hospitals which have been closed. This is also especially due to the invention of the DRG system. Hospitals now have to be effective, and if a hospital does not get enough patients, then the owner is in general good advised to close it down. This is also an EU triggered process. The EU said that deficit spending by public owners is not allowed, or is only allowed under special conditions. So local parliament or cannot unrestrictedly put money into its own local hospital due to EU law. So this is also a reason for hospitals to be closed down. But we can also see that mergers are also diminishing the numbers of hospitals.
Thank you, Marc. I know that is a concern for a lot of folks. Julia, maybe this is a question for you. What role do you see IT, I guess connected health, in the hospital sector in order to continue to increase hospital effectiveness?
Well, the digitization of the healthcare industry has two major advantages. Well, on the other side, we can increase the quality of our provision, healthcare provision, and on the other side, and what is so important nowadays, is to increase efficiency. For example, in hospitals. And the digitization of processes and of data can really help make work in hospitals more effective. Of course, we have to be really careful with that. It's about data, patient data. It's about data that really has to be secured. But it plays a more and more important role also in Germany. We see many hospitals that invest more in the digitization and use it as a tool, as I said, to do both things, to increase quality and to make processes more efficient.
Thank you, Julia. We've gotten so many questions, it's actually quite difficult to keep up. Can someone briefly describe the environment of care outside the hospital, such as home health care and other options?
The question is for whom?
Anyone who can take a stab at it. Marc, you want to give it a shot?
So yeah. We have the primary care sector with 160,000 doctors working there. They are working on their own bill, so to say. They are their own bosses. They get contracts with the statutory health insurance funds as well. So once that they have the admittance, they can treat patients from the statutory health insurance funds. They have an own organization, the Federal Association of Salaried Doctors, which is the adequate organization to the German Hospital Federation. This KBB, we call it in Germany, has the same tasks, also to develop an own reimbursement system for the doctors. The doctors are divided in special groups. The one group is the normal practitioner, the general practitioner, which provides basic care. He's the first where patients go to. And then also, and this might be viewed by the international perspective, something very special, we have also a big group, almost a half, of specialty doctors. So you have the same specialty functions in the primary care than in the hospital care, which allows the patients to be treated in an ambulatory setting at a very highly specialized system. Hospital care in regard of primary care is subsidiary, so only if the means of a primary care setting doesn't heal the patient, then he can go to the hospital. So this is the great the general description of the primary care setting. As I said, they have the same problems, especially the demographic problems, that not only our patients becoming older, but only the staff in the primary care sector, also in the hospital sector. So we have actually a big discussion, a reform law about how to bring doctors in rural areas. not only in the very dense populated urban areas, but also in the rural areas where we have also some kind of in Germany. And this is one problem. And the next problem is that in the primary care sector, especially for the specialists care in the primary care, patients sometimes have to wait quite long time. So our minister was making the proposition by law that a patient should have a claim, a legal claim, to get an appointment with a specialist doctor within 4 weeks only. And for this reason, the KBV, so the Federal Organization of Primary Care Doctors, they have to invent an organization, which is a telephone number, an office, which provides an appointment with a special doctor within 4 weeks' time only for every patient who's asking for.
Thank you so much. Rühle, did you want to say something, or? No pressure, of course. Great. One more, we'll do a couple more questions for the sake of time. What is the average wait time for an appointment in Germany? I just lost the question here, but there was a statistic about Canada. It's about the average is 9.5 weeks wait time. What is it in Germany? Marc, probably a question for you.
So for hospitals, there is no waiting time at all. As I showed you on my slide, we have an occupancy rate of 75% almost. So in short words, there's always a bed free, to be a bit funny. So in Germany, there is no reliable, in the hospital sector, there is no reliable waiting time. But in the primary care sector, there is some waiting time. And here again, it is not possible to say how many. This is depending from the specialization you want to have an eye on you. So sometimes it is reported that people have to wait up to 6 weeks even, or even longer, to get an appointment with a special doctor.
We will take one more question for the sake of time for both our speakers and everyone else. I apologize that we could not address all the other questions, but I do have them recorded, and we will get back to you. Final question. Are hospitals in Germany encouraged or incentivized to improve their DRG system and/or as well as the patient safety and care quality? I know that's a loaded question. Marc, probably a question for you. Is there any encouragement or incentivization by the German government for the hospitals to continue improving?
So the biggest incentive is the free choice of the patient. He can go to which hospital he wants to. So the hospitals have to provide the best care. And as we have to publicly report on our quality, patients can choose directly by comparing which kind of quality is delivered in the respective hospitals. But the second part of the question, incentives to develop the DRG system, yeah, this is a legal task which is not fulfilled by the hospitals themselves, but by our Federal Organization of Hospitals, by the Federal Association of Statutory Health Insurance Funds. So this is, let's say, an autonomized process, the developing of the system. But to bring a next point to this discussion, in this big hospital reform we just are discussing these days, we are awaiting a first draft in the coming weeks. In this new draft there will be also the idea to pay for performance. So this is a continuously requirement of the statutory health insurance organizations to have the say by pay for performance. So this will be a big discussion now in Germany. We can say from the side of the German hospitals that we are open to get extra fee or extra spending for hospitals who perform in an outstanding way, but we are of the conviction that it does not help to reduce a fee for bad quality. This would not help. This would not enable a hospital to bridge the quality gap. So our mean is, if pay for performance means an add-on to the usual fee, then it would be an discussable approach.
Thank you, Marc. Those were excellent closing comments. I think we will end right there. Again, thank you so much, Julia Rühle. Thank you so much, Marc Schreiner, for your time and for two great presentations and an interactive Q&A session. We really appreciate that. It's what makes this webinar series so successful. Again, here is the URL. You will find the presentation. You will find this webinar. You will find previous webinars. You have my contact information. I wish you all a wonderful evening, a wonderful day, a wonderful morning, and I have plenty of shoveling to do outside. So thank you so much again to my speakers. All the best, and goodbye.